So the general landscape of rare and complex epilepsy changed. So it was a true change in the view on epilepsies. Generally spoken, about 1%, 1.5%, depending on where you live in the world, of the population have epilepsy. So it's a highly prevalent disease. But here is the first change in the view of epilepsies. It's not a disease, it's a group of diseases. It's a heterogeneous group of diseases. Some of them are easy to treat, and that's the good message. 60% become seizure-free with the currently available drugs. But the other 30 to 40% are drug resistant, and they are causing severe problems and impairment of quality of life. Many of them have genetic causes, and here comes the point of the rare causes, because each of the genetic causes, when they are single gene disorders, they are very rare. Some of them are extremely rare, and the other ones are complex. What does it mean, complex? Complex means that you need not only one discipline, you need more disciplines for diagnosis and proper treatment. And in our reference networks, EpiCare, for rare and complex epilepsies, the term complex refers to the epilepsies where surgery is an option. So the pre-surgical evaluation is multi-professional, interdisciplinary per definition since the onset. So this is why we have two parts. One part is the unraveling the genetic causes of epilepsy, and the other one are the complex diagnostic in the pre-surgical evaluation. But aside from epilepsy, there are also many other causes. And one big group of causes is the immune-mediated epilepsies. They have been discovered some years ago. Some of them are mediated and belong to the paraneoplastic disorders. So you have to search for a tumor in these patients with many cases a late onset epilepsy, and they are associated with specific antibodies. And other ones have direct antibodies related to surface structures of the neurons. These ones must be treated very heavily with immunosuppressants, immune modulators in the acute phase, but also in the chronic phase. So aside from the simple anti-epileptic drug, which is now called anti-seizure medicines, we use a whole range of different treatments, from cytostatic treatments, which are mainly used in the oncology, but also rheumatology and other fields of neurology, to the immunomodulators, antibodies, biologicals. So epilepsy treatment becomes very complex. And the key message number one is there's no such disease that we call epilepsy anymore. We call it the epilepsies. It's the plural, and we always have to identify the cause and treat the cause appropriately.